Hi, good morning, everybody. This is Dr. Jennie Byrne from Cognitive Psychiatry of Chapel Hill. Um, Today, I'm going to talk a little bit to continue my series about lessons I've learned from my patients. And I thought a good topic for today could be anxiety, since this is a really, really common topic that comes into the office. We talked a little bit about depression the other week and how everybody experiences depression at some times, but it's not always a clinical depression. So anxiety is kind of the same. We all experience anxiety, and it's a normal part of being human. It's just when the anxiety gets out of control or causes problems, that's when we typically see it here in the office. So some of the things I've learned from patients about anxiety, I think the number one thing is that anxiety feels different to different people. So what do I mean by that? So anxiety can be something that you feel in your body primarily. It can be something that you experience as anxious thoughts, or it can be a combination of the two. And there are different kinds of anxiety. There is anxiety where you're kind of anxious all the time, you're worried, you're thinking about it all the time, you're just kind of an anxious person. That can be generalized anxiety. There is panic attacks, some people call them anxiety attacks, where you have an extreme anxiety, normally that you feel in your body as well as your thoughts, that doesn't last as long, maybe it lasts like 15 or 20 minutes. Those are different than kind of a general anxiety. And then there's another one that my patients tell me about quite a bit, and this is actually sometimes the worst one of all, which is when you worry about worrying. So in other words, you anticipate getting anxious, and so you worry about worrying in the future. So a good example is if someone's had a lot of panic attacks, they say, the panic attacks are really bad and awful, but what's disabling to me is that I worry about having a panic attack. And so I do all sorts of things to try to avoid having a panic attack. Like I don't want to drive anymore because I had a panic attack in the car, so I'm not going to drive. Or I'm not going to eat certain kinds of food because I had a panic attack after I ate them. And their world starts to get kind of smaller and smaller because they're so anxious. They're having anticipatory anxiety. So this is kind of a concept that comes up a lot, and a lot of patients tell me that the anticipatory anxiety is actually what's worse. That's the worst part of it because they can't seem to escape from it, and it really affects how they live their life. So what do my patients taught me about what to do in these situations? Well, I think one of the most interesting things about anxiety is that when you understand your anxiety and you are educated about what is going on in your brain and your body, sometimes that can actually take away the disabling part of the anxiety. It's really interesting. It's like you can shine a spotlight on it and understand it, and somehow just by putting light on it and understanding it, it gets much less. Now, this isn't always the case. So what's an example of this? So I'm going to tell you a little analogy that I tell a lot of my patients, and they really like it. When you are having a panic attack or an anxiety attack, what is that like? People will tell me, I get extremely anxious. I feel like my heart is beating out of my chest. I'm breathing super fast. My heart is pounding. My stomach is upset. I'm dizzy. I feel like I'm going to pass out. I feel like I'm having a heart attack. Maybe I get tingly sensations. It can be a whole variety of things. And it's very intense, and it lasts for typically a short amount of time. So when we talk about panic attacks in the office, sometimes we use this analogy of an animal being in the jungle. So what do I mean by that? So as humans, we are all animals, right? We all have a nervous system that is similar to other animals in a lot of ways. And one of the things our nervous system is there to do is to protect us from danger. So let's imagine, we're an animal or a human and we're walking around in the jungle and a lion jumps out at us. Well, what does your body need to do? It needs to react and get away from this danger. So there's something you might have heard of called the fight or flight response, where you get this wash of chemicals in your body, adrenaline or norepinephrine, and those chemicals tell your body to either fight that lion or run away. And so a lot of the things it does in your body, if you think about an animal needing to run away, you can understand what's happening in your body. So starting at the top, you need to have a lot of blood rush to your brain and to your muscles, right? So your heart starts beating faster, your blood pressure can go up. You also need a lot of oxygen, so your respirations, your breathing can go up. You need to get tense and ready to do something, so your muscles tend to get very tense. What about your gut? Why do people feel like when they're panicking, their gut gets so crampy, or they feel like they're going to throw up or have diarrhea or something like that? Well, if you think about it, a lot of blood has to go to the gut to digest our food. So if you just ate a big meal and you're in the jungle and then the lion jumps out at you, you don't want your blood and all of your energy going to digest that food, right? So maybe you need to just throw that food up and vomit, and so that way you're not worrying about it and you can get out of the way of the lion. So the stomach tends to kind of cramp down and the blood stops flowing because you have to fight that animal or run away. Sometimes you get dizzy where your blood is rushing to the head. There are a lot of different sensations you can have, and you can imagine if you were the animal in that jungle, why you would have those sensations. So what's happening when we have a panic attack? Well, sometimes my patients will tell me, well, I have panic attacks and I've always had them in stressful situations, like I had to do a presentation or before a test. And that made sense to me because everybody gets anxious in those situations. But I had a panic attack. And they can understand that, right? Because there's a situation that they're reacting to. But then what happens, sometimes they say, well, but now it seems like I'm having those panic attacks even when nothing is wrong. There's nothing stressful. It just came out of the blue. So how do we understand that? One analogy I talk about with patients is that basically your body is misinterpreting some kind of cue to tell it that there is a danger. That cue can be outside of you or that cue can be inside of you. So for example, if you're an animal walking in the jungle, right, and last time you saw that lion, there was a bright red bush beside you. Well, now maybe you're going to see that bright red bush and it's going to trigger a reaction even though there's no lion. So there could be something external in your environment that maybe is triggering a panic attack in error because there's no real danger. But what's even more interesting is sometimes an internal sensation can trigger a panic attack. So let's say that you are exercising, right? And it's normal when you exercise that your heart rate is going to go up, right? Because you're exercising and you're working out. Well, people who are prone to panic attacks, sometimes that increase in heart rate can trigger a feedback loop in our brain saying, oh my gosh, my heart rate's speeding up. That's something I need to be alert for. There's danger coming. And then that starts the whole cascade of chemicals and can actually trigger a panic attack. And what's tough about this is those internal sensations we're not normally aware of. So, we may read something happening in our body as a danger cue, and there's no danger at all. And we're not even aware of what that cue is because it's inside of us. So I know that sounds kind of strange, but if you've ever had a panic attack or you know anyone that's had them, you can ask them what it feels like and see if they get that kind of body feeling. So understanding that the body is doing something normal, it's a normal response. A fear response is normal. It's there to protect you, but it's getting triggered in error. So sometimes by understanding this, my patients have told me that it's a lot easier to cope with the panic and to understand it because they understand that it's just their body doing something, it's normal, but it's just happening in error. And there's some strategies that we work on to try to reteach the body. which I'm not going to talk about today because that's kind of another topic. So I hope that makes sense. There's one more thing I wanted to talk about, which is that anticipatory anxiety that a lot of patients come in with me to talk about. And that anticipatory anxiety is really tough. And so what I've learned from my patients about this is by understanding the difference between anticipatory anxiety and anxiety that's actually happening at the time, sometimes it's easier to calm those things down. So for example, if you have a lot of anticipatory anxiety about having a panic attack, and you understand that the panic attack is nothing dangerous, it's just your body getting cued in error and nothing bad is going to happen to you, sometimes then you have less worry and less anticipatory anxiety about having one, if that makes sense. Or say you're worried you're going to have a panic attack when you drive your car. Well, the more you get out and you drive your car and you don't have a panic attack, you're teaching your body that it's okay, there's no danger, and then you anticipate it less. And when you stop anticipating all these bad things happening, then it's easier for you to kind of go out and live your life and drive a car or do whatever you need to do. So I hope this was helpful. Again, a lot of my patients have taught me, I guess, to really think about the different kinds of anxiety and how each person is experiencing it individually. And it's interesting because there are a lot of similarities from person to person. But in terms of how it actually feels, it tends to be pretty different for different people. So understanding yourself and understanding the different kinds of anxiety you might be experiencing sometimes can really help reduce the severity of your symptoms. And if not, there are other treatments like cognitive behavior therapy, which is highly effective for certain kinds of anxiety. And then there are also medications too. And sometimes people, if their symptoms are really severe, will take medications so that they can do the cognitive behavior therapy, and then eventually they come off the medication. So it's not exclusive like you just do therapy or you do medications. So I hope this has been helpful, and I hope you all have a great week. I will plan to see you next week, and thanks again for joining. Bye-bye.